Yeah, the mission of VHC Health is actually very simple. It's just to be the best health system. We measure it as the whole value proposition on healthcare. It's low cost, high quality provider that's out there. So we focus a lot on our patient satisfaction scores. Improving patient experience, we kind of identified that as a key objective. I'd say about 2 years ago, maybe 3 years ago, our board of directors gave us a challenge about growth. And the only way that we can get to the levels that we wanted to do and attract that was to get into the digital space and jump onto that with both feet. The 4 key strategic priorities we wanted to achieve as a part of this initiative are expanding access to care, optimizing our resource allocation, improving patient satisfaction, and reducing unnecessary care. Yeah, I think the biggest improvement from the patient experience is the self-sufficiency. From the patient's perspective, we always look at everything from their eyes. So their ability to maintain control of what's going to happen and when it's going to happen and where it's going to happen. Part of this initiative that we've done is move to a kiosk enablement out there for self-sufficiency with them. And that kiosk contains all of the devices necessary that you would do as if you were a registrar sitting behind a desk, including the credit card, copay collections and things like that for the point of care that's there. In the first month of that collections that were there, that we enabled, we exceeded $450,000 in the first month. The biggest win that we think we did out there, because it was one of our biggest pain points with the patients, was going to what we call our 111 philosophy. One patient, one consent, once a year out there. And so now when you show up at a practice and you sign your consent form, the next point of care, if you go to a lab or procedure or something like that, no longer do you have to do that. All they do is validate that nothing's changed in your thing, and it's all in the record already. And then it automatically prompts them, once that 366 day is there, it automatically prompts them that they need a new form, but it never prompts them before that. Partnering with Nordic has been very successful. There are many, many people out there that can help you with building Epic things or building digital things that are out there. But we really wanted somebody who could see both, who have view of multiple customers out there and what other people in the industry are doing. So they bring that to the table for us, but also helping us guide and restructure our internal processes that are there. The expertise that they bring is it's no longer just Epic knowledge. It's well beyond that these days with what's out there. That's what they're known for. But in this process, yeah, that knowledge was helpful, but it's really getting into the healthcare process and the patient access processes so that those patients have a smooth experience that's out there. And they're probably one of the few that can actually do that, in my opinion, out there right now in the market.